We have known about asthma for well over 2,000 years, first described by Hippocrates around 400 BC. As ancient as asthma is, today it still affects 300 million people worldwide. As well, prevalence rates are increasing by 50% per decade, so we really need to figure out a better way to treat asthma. Asthma is a chronic lung disease that causes inflammation of the airways, which are the tubes that carry oxygen in and out of your lungs. As seen on the bottom left, when a patient with asthma breathes in allergens such as dust mites or mold, the bands of muscle around the airway tighten and contract, restricting airflow. There is also an increase in mucus, which can block the airway. Importantly, there is also thickening of the airway wall due to scarring. As you can imagine, all of these changes make it very difficult for a person to breathe because there is less airflow through these tubes. So why isn't there a cure yet? Currently, inhalers are the main treatment for asthma, and while these are able to temporarily relieve constriction of the airways, they unfortunately do not reverse airway wall thickening. What this really means is that even if an asthmatic patient is very diligent with taking their inhaler medication routinely, they will still experience lung function loss over time and have a progressively harder time breathing because of permanent airway thickening. In a person, we don't know exactly where in the lungs the disease is occurring. Previously, the clinical CT has been very useful in visualizing some of the airway tree, but as compared to the lung cast on the right, which is made by pouring resin into the airways, showing all of the airways in the lung, the clinical CT is missing so much of the lung structure and airways. So my master's project is going to take advantage of two new, very exciting techniques. The first one is a high-resolution imaging method called the micro-CT. I'm showing you an example here in the middle. Using this new technology, I can actually even see the smallest airways in the lung. This will enable us to finally understand how and where airway wall thickening occurs throughout the asthmatic lung and leads to changes in the ability of a person to breathe normally. Next, we will then use cutting-edge single-cell imaging technology developed very recently to image, for the first time, all of the cells present in the airways in the asthmatic lung. In the pink box, each color that you see is a different cell type. Ultimately, this technology will help us determine which cells are causing airway wall thickening so that we can next target and modify the activity of the cells that are responsible. This new knowledge will allow us to develop better drugs to enable 300 million patients with asthma to breathe more easily each day. Thank you.